everyone. Welcome, welcome, welcome. I'm so grateful that those that are attending live right now have joined us. Your questions and your views are really important to us, and so we appreciate you taking the time bright and early on this Friday morning, 8 a.m. We had a conversation, a large part of our panelists here, and have been meeting regularly in an effort to want to communicate a unified message across our county. And this became evident really early on. And so I am so excited that we are getting to share this with you. And truly, this is a resource that is only as good as you allow it to be. So your questions are so vital and so important to us. And thank you so much for participating. I am Morgan Gache. I'm the CEO of the Calaveras County Chamber of Commerce, and it is such a pleasure to be able to host this. As you can see, I'm in the lovely downtown San Andreas right now. So it's such a thrill to be able to work with these wonderful people that are panelists on the call, and even a lot of you that are attending. So such a privilege. Emily, you want to introduce yourself?
Oh, sure. So I'm Emily Graham. I'm the Center Manager for Motherlode Job Training and America's Job Center of California. And we are located in San Andreas, right across the hall from Morgan, actually.
Awesome. And Debbie, you want to introduce yourself?
Good morning. I'm Debbie Pawnee, Executive Director of Destination Angels Camp, public-private partnership with the City of Angels Camp for economic development.
Awesome. We got a little bit of feedback on yours, Debbie, just FYI. And Kathy, your turn. Oh, put that coffee down.
Hi, everybody. I'm Kathy Galino. I'm the Economic and Community Development Director of Calaveras County. And I'm very thankful to be here with these wonderful people.
Awesome. We're so happy to have you. Colleen, you want to introduce yourself, your emoji?
Hi, everybody. I'm Colleen Rodriguez. I'm the Deputy Director of Public Health for the Health and Human Services Agency right here in San Andreas.
Huge asset to us, but lots of great information from her. And then Kristen, we'll end with you. Would you like to introduce yourself?
Sure. Good morning. Kristen Stranger, Health and Human Services Agency Director, Calaveras County, located in San Andreas as well.
Awesome. Awesome. Well, thank you so much for all introducing yourselves. And, you know, I am going to kind of ask Kristen if she's willing to be put on the spot and to talk to us a little bit about the changes we've had. And I think because she was so intimately involved with everything from the attestation, can you talk to us a little bit about you know, officially what happened and what that means for businesses now that we are in phase 2. And then I'll have Kathy kind of give us a tour of the resilience roadmap.
Sure. So as everybody knows, with the governor's executive order and with moving away and out of phase 1, which was really a universal kind of shutdown of all non-essential businesses, and that's what we've been living in for the past couple of months now. And so with, I think it was about a week and a half ago, the governor had made an announcement that there was going to be the ability for locals to have variations to be able to advance to phase 2, which was loosely defined at that time. But as this entire COVID pandemic response has been, it evolved and took shape very quickly for what that was going to actually look like. So for communities, particularly ours, other more rural, you're seeing a lot more in the Northern California area that have lower disease activity. The governor's office heard the feedback of many of the local health departments, as well as the local elected representatives and the local constituents, just saying, you know, the COVID response looks different here, and we'd like the opportunity to be able to be mindful of the public health response and maintaining those gains that we've had in terms of mitigating the disease activity, but we want to have the ability to move forward and reopen some of our local businesses. So that opportunity was provided, and the way that that materialized was that the governor's office released to counties late last week a form called a variance attestation, and counties had to move. Those of us who met the immediate criteria, which was, it was actually quite a lengthy criteria, but those of us who met the immediate criteria, meaning we had low disease prevalence, or we didn't have deaths, or we had the ability to contact trace. There was a number of various factors. Had the ability to submit an attestation. And what that attestation did is basically had our local health officer say, I certify that we have met these criteria, and that we are in good position to be able to reopen our a certain amount of our businesses as part of the stage 2 guidance with very specific modifications. So we went ahead and did that as a county. It was posted to the CDPH website on the 13th, I believe it was. And all my days are starting to run together, but it was posted on the 13th. And then we were able to move forward. So in terms of how this affects the local dine-in restaurants, we're very pleased to see that was part of the ability to reopen with specific modifications. The state had been foreshadowing that there would be specific guidance about what would need to be in place prior to businesses reopening, but we didn't actually see that finalized requirements until this past Tuesday. Actually, during the Board of Supervisors meeting is when it was posted, the official guidance. So prior to that, the direction that had been being provided was in draft form, or it was best practices, and that's what you kind of found on our COVID-19 webpage. That's what we were pushing out through the chamber and through Kathy, best practices and such. And that's what many counties were doing their very best to try to prepare locals for what would be required. And so then when the final guidance came out, it did fall very much in line with what we had kind of been preparing for. It was the sanitation measures, it was these increased social distancing, et cetera. And the two documents that are most pertinent, and the state did make them available sector by sector, is each sector that has the ability to open, in this case, dine-in restaurants, for the purposes of this webinar, has a guidance document and then a checklist. And those are the two documents that will serve as the material and your go-to two documents. Did that kind of cover it? And I think one more thing I wanted to add before we advance is, this is what we're in right now, what Calaveras is in amongst, I think it was 19 other counties when I checked late last night. We are in full stage 2. We asked for and we're approved. I use that term loosely because we were posted for full stage 2, which means every business within the stage 2 parameters has the ability to operate with these modified specifications. We do not have the ability at this time to advance into stage 3. We expect to see more guidance of what that could look like in the next couple of weeks. We're not entirely sure. This one, the state has been pretty direct about the fact that stage 3 is something that they will dictate to us and what that's going to look like.
For the sake, thank you, Kristen. For the sake of what we're trying to accomplish with this call, it's not trying to understand the potential of the future. It's truly trying to understand the here and now and what we can do. And so this is a forward-moving call. And so I'm so grateful to have Health and Human Services and Public Health and able to give perspective, because it is confusing, and all of us, I'm so appreciative that we're able to actually be approved to go into the full phase 2. So thank you for all of your hard work there, both Kristen and Colleen, and I know Dr. Kaleda as well. And so we are grateful for that. So thank you. A couple of things that were mentioned, and I'm sure everyone in attendance has already seen it at some capacity, but are the guidelines and the checklist that she was talking about specifically for restaurants as we move into dine-in, limited dine-in. And so what I asked is if Kathy could actually do a screen share and give us a little bit of a tour in case you haven't seen it. For the sake of trying to do the best that we can, be the safest for our community so that we don't fall backward and have to reclose anything, we all very strongly have verbalized our desire to help disseminate information and make it as bite-sized and edible as we can for all of you that have restaurants, because it is confusing. And so that's what we're here for. We're here to kind of break it down for you. So Kathy, do you want to share your screen so that we can kind of see what you're talking about here?
I will.
Awesome.
Can you see it?
We can.
So as Kristen mentioned, this is the guidance that is on the state's website. And this particular breakdown that we're going to be working on today is for dine-in restaurants. And we are very thankful and happy that we can move forward. So a quick overview, and I think the most important thing that I really want to share is that it's important that we keep ourselves, our families, our communities, our employees, and those that come to our businesses safe. I think we've all been through some difficult times and it's unprecedented, but I think if we move forward safely and smart, that we can move forward and be back in business. So the purpose of the document is guidance for how to open for in-dining restaurants. And if I'm going too fast or there's any questions, Morgan, I'm going to let you kind of be our moderator if there's any questions as I'm going through.
Got it.
So I need to.
Hey, Kathy, do you have the website up so you can show us how you access that too? I mean, that might seem minuscule and maybe most people know, but just for the sake of how they can find this document, that would be really helpful since they moved
Okay.
to this one.
Let me go right there.
I
Kathy,
put it
if
in
you'd
the
like-
chat if that's helpful.
I was just going to say that. Go ahead, Colleen.
What?
Sorry, I put the URL in the chat, so if people are
That's
want to
super
go
cool.
to it, they can click it and copy it and all that.
Perfect.
Awesome. Okay, so can you see the website?
No,
Or am I not sharing that?
you're not sharing that. And that's okay. If Colleen put the URL, then we're probably good.
Okay. So now I get to go back. All right. So a few questions that have come up to me are brew pubs, breweries, bars, pub craft distilleries, and wineries should remain closed. Those are actually in phase 3. However, if they're offering in-room dining, in sit-down dining and meals, the alcohol can be sold at the same time as they're having their meal. We are still encouraging, or the state is still encouraging, takeout and delivery whenever is possible. I'm just going to hit the high points. I mean, most folks have the ability to kind of read this for themselves, but there's a few things that I really, really want to point out. And one of them is, so this is one of the points. So producers of beer, wine, and spirits should follow the guidance for manufacturing operations, which is different than in room or in dining for dine in. And of course, you know, concerts, performance, entertainment venues where alcohol and food are sold, that's going to be a much later phase. That's probably going to be phase 4. So one of the questions that I also got was, how do you develop a workspace or workplace specific plan? So this is actually a written document that the restaurants would put together. And I did a draft one, which I'll share with you shortly, just kind of what it would look like. So it's very specific to each restaurant. And you do a risk assessment where you can identify where your high risk areas are for your employees, for yourself, for your visitors that come in and eat there. You want contact information for your local health department, and train and communicate with your employees. That is super, super important. So the other part is to identify and try and keep your folks, your employees and people that are coming in, doing some screening and identifying whether they're sick, they're not feeling well, and taking appropriate guidance, which we're going to go through here in just a minute. And then of course, the identify close contacts. So those are going to be like your servers or those that are going to be within 6 feet of people for 15 minutes or more. And make sure you take steps to isolate. If one of your employees does come in, is not feeling well, that you're concerned that they may be sick with COVID, to make sure that you isolate them and allow them to, or ask them to please go home. So how to prevent topics for employee training. So one of the things that when I've talked to a few restaurants is that they're doing morning briefings with their staff and their employees to talk about whether it's their cleaning protocol to prevent, any potential exposures or spreading the disease. Self-screening at home. You can ask your employees to self-screen at home, which includes temperatures and or symptom checks. So it doesn't necessarily have to be doing temperatures. It could be symptom checks using the CDC guidelines, which I'd like to pull those up. Let's see if this works. Can you see the symptoms of coronavirus?
We can't see it, Kathy.
Now can you see it?
We can.
Okay, that's not where I wanted to be though.
Can I jump in really quickly, Kathy? This is Colleen while you're trying to find that site.
Okay.
I just also wanted to, when you go back up, if you go back up to the top of the document, there's some OSHA and USDA links that are also really helpful for folks that have downloadable resources, that have infographics, that have all like different things like that. Those also might be helpful for people as well. And those can be found directly in the guidance right up at the top. So I just thought I'd add that in there. The CDC guidance is really, really helpful as well.
Right. And which screen are you seeing? I can't see which screen you see.
No, when you scroll down just a little bit to purpose, go back up to purpose, right there. Go scroll down a little bit, stop. See how it says stop? The OSHA one, but the USDA, the United States Food and Drug Administration has guidance for restaurants. That
Yes.
particular one has stuff on there as well that is, I think, really helpful because, like I said, it has infographics, and I think those just make things a lot easier for people to look at.
So let's see if I can. Did it come up? The best practices for retail food stores, restaurants, and food pickup delivery services?
It did.
Yay. I'm getting better at this. So this is what Colleen was referencing. It's be healthy, be clean, clean and disinfect, social distancing of at least 6 feet, and encouraging pickup and delivery. So these are great infographics. I love infographics. It makes things a lot simpler. So this is the link that's directly on the purpose section of the guidance document that the state has put together. And what's nice about the guidance document is that it does have hot links to all of these documents. So I'm going to go ahead and go back to the guidance.
Kathy, can you talk a little bit about the difference between the guidance and the checklist? Because I know that, in fact, I think it was Colleen that caught me when I was saying earlier in one of our conversations that, oh, there's a checklist. That's great. So we can just go to the checklist and check everything off. And she was like, no, wait a minute. The guidelines are also there for a reason. So can you talk about the difference between them and why we need them in tandem?
Okay. So what I have, which is it starts with a big dark blue page. So there's the COVID industry guidance for dine-in restaurants. In tandem with that is the checklist. So let me show you what the checklist looks like. Are you seeing the checklist?
We are, if you want to scroll down.
So this is the checklist that goes in tandem with the guidance. And yes, it is a checklist, but you want to make sure that you look at and understand the guidance document before you just check the boxes. And this is where I was talking about developing of the written worksite specific plan. And I'll pull up a draft in just a moment. But you want to know and identify who is the person responsible for implementing this plan, whether it's the owner, a manager, that you conduct the risk assessment and identify areas that are high risk, their touch points, whether it's handles, ATM machines, or, payment machines, handling cash, restrooms, all those areas that are going to be your high touch points for transmitting the virus, that you're doing training and communication with your employees, and you're updating the plan daily. Things may change. You're going to have to practice your social distancing and have a plan for that.
I'm going to edit what you said. Things will change.
Things will change. This is very fluid.
They will change.
That's kind of been the motto. And then again, a process to investigate whether you have an employee or a potential patron that comes in that may be sick, and alerting the local health department, and isolating close workplace contacts of infected employees. Hopefully nobody has any infected employees until they're properly tested. So other topics for employee training are, preventing the spread, self-screening at home. Again, I can't express the importance of this enough. If people can say, I'm not feeling good, I'm running a fever, I'm not feeling well, I got aches, got a sore throat, really encourage them not to come in.
Can I pause you really quick on that?
Sure.
Am I getting feedback? Can you guys hear me? Okay. So as a former working in a restaurant person, and managing a team, I know how stressful it can be when things are tight and then you have someone saying like, oh, I'm sick, and calling out, and that can be really, really challenging. And obviously we're living in a different time, but it's going to take a lot of work on both management side and on the employee side to be really communicative with each other in ensuring that they feel safe in calling you to let you know that they're going to be sick and that they're not feeling well. I know that in the past I probably gave them a little bit of a hard time and saying like, doctors know, or something like that. And we just want to be really prudent in making sure that we're not going to be a transmission location. So I just wanted to speak to that for a moment.
Thank you, and that's true. I think people are a little more sensitive though now to when they're not feeling well, and people are paying attention to themselves a little bit more. But again, other training topics are, the use of face coverings properly, and then providing information if your employees, need workman's comp assistance or leave benefits, and what those are for your business. So individual control measures and screenings, symptom screenings or temperature checks. This has been a kind of a hot topic because people are like, well, where can I get thermometers that are not the non-touch type thermometers? Getting supplies and things has been difficult, that I've heard from businesses. So you can do symptom screenings, which we will get into in just a moment. As I mentioned, if your employees are feeling sick, to stay home, and frequently hand washing using hand sanitizer, disposable gloves, and disinfectants. These are all great topics to go over, and there's more detail in the guidance. Here's another one. So increasing the distance between tables and chairs. So the guidance, if I can go back to the guidance.
While you're going there, Kathy, Colleen, you just made a really good note in the chat. Do you mind talking about that a little bit with the face coverings?
Yeah, so I just wanted to point out that, excuse me, it says face coverings, not face masks. Mm-hmm. And I know that seems like a kind of, I don't know, like strange distinction, but it's because what we're saying is that folks don't have to use like those medical masks like they use at the hospital. They can use those, the homemade ones. There's some really adorable ones out there. I've even seen people customize them for their particular industry. So I wanted to just let people know that. And then I also wasn't sure if people knew, I mean, I didn't know this myself, but for COVID, the temperature is, you're considered to have a temperature if it's 100 degrees. And we check every employee every day for public health when they come in. And so you don't really have to have a lot of fancy equipment to do that. What we do is we check and then we sterilize the equipment, and then we check the next person and sterilize the equipment. So it can be done. We do it in phases. So people like wait in their car, and then when the next person is done, they come up. So there's ways to do it that aren't super like a pain.
Yeah. Thank you, Colleen, for sharing that. Back to you, Kathy.
Okay. So we've talked about employee training. So here's more. So I'm back at the guidance document, which has a lot more detail. So part of your screenings: difficulty breathing, chills, muscle pain, headache, sore throat, and seeking medical attention. The importance of frequent hand washing with soap and water, including scrubbing with soap for 20 seconds. And I think if you sing happy birthday twice through, that's about 20 seconds. Most people think 20 seconds is forever. I know when I started counting, it was a lot longer than what I thought. And then the hand sanitizer with at least 60% ethanol or 70% isopropanol. And I know that's been another issue that's come up, is businesses are not able to get supplies. And we do have resources for you on that at the end of this webinar. Physical distancing, I think everybody's pretty alert and aware of what 6 feet is, hopefully. And businesses may want to put down, tape. And I know that there are a few local businesses that actually have COVID kits for your business that actually have signage that you can put on the floor, and other signage for your building.
Kathy, I want to, maybe while you're doing your tour, would be a good time to bring up questions, because some of you watching may have questions already that pertain to what she's going over. And so let's talk about, most people should know the 6 feet distance, which if you go to grocery stores, unfortunately, sometimes people don't give you quite that. They don't respect that, even no matter how hard the grocery stores work to provide guidance. But let's talk about what that looks like for restaurants in 6 feet. Can you walk us through that? And how does that look for dining in with tables and with standing in line and with waiters too?
Absolutely. So in talking to some restaurant owners, what they're looking at is they're looking at the occupancy of their building. So say your occupancy is 35 people. The recommendation is cutting that by half. Another recommendation is also to make sure your tables are spaced at least 6 feet apart. If you're not able to move your tables, if you have bench seating or permanent seating, then like doing every other booth, so that you've got social distancing between your patrons coming into your restaurant. What's some other guidance here? I'm sorry, I'm like flipping around here. I kind of had an idea I was going to go through this piece by piece, but I think it's probably better to go this way. Other ideas are consider allowing your dining customers to make reservations ahead of time so that you can kind of manage how many people you have. If people are waiting outside or waiting to come in, have them wait outside, and you might want to put just little signage on the ground, spacing people 6 feet apart while they're waiting, or if they're waiting to check out, same thing. There's also the buzzers. I've not seen that up here in Calaveras, the little buzzers where you wait in your car or you're waiting in the waiting area and then your buzzer goes off and then it's your time, your table is ready. I don't think that's used up here very much, or I haven't seen it up here.
For the viewers that are watching right now, if anyone is currently employing this and has an actual example, can you raise your hand and I'll have you kind of share what you're doing, because I think that's important to show in real life, since the 6 of us actually aren't physically in restaurants like you are. And so if you have an experience that of how you're acting that out, let us know. Raise your hand and let us know.
Yeah, because there are a lot of restaurants that are doing great stuff. They've been very proactive. Bar areas should remain closed to customers. So that's an
Okay,
FYI.
I'm gonna let Kathy, I'm gonna let Gina Galloway talk here. So Gina, can you hear us? Can you talk and let us know?
Yeah, I can hear you.
Awesome. So what are you doing to employ this right now?
So we are actually fortunate because we have so much outside seating area, but we have spaced all of our tables inside, are all 6 feet apart. And then we expanded our front patio area, and we actually only lost a couple of tables because we have a garden area in the back also that that we don't use very often, that we used to use just for, you know, private groups and parties and things. But now we have put tables in that back area and they're 6 feet apart. So we're able to seat a lot of people outside also because we have more space. We lost tables inside because we're not very big, but you know, we have a little bit of inside seating still, but our outside seating really expanded. And then we have tape on the walkway coming into the restaurant. So if people, and a sign saying, you know, did, and tape 6 feet apart for people or groups or whatever that are coming in to dine, that's where they stand and wait for somebody to come in and dine. And it seems to be working for us really good.
What kind of tape did you use?
It's just duct tape.
Masking tape?
Yeah, duct tape.
Awesome.
Yeah.
Thank you, Gina. I appreciate that.
I don't know how well it's going to stay, but we'll probably have to replace it several times.
You'll find out after the rain, right? Well, thank you for sharing, Gina.
Sure.
All right, Kathy, back to you.
Okay. That's great. I mean, and it's nice to have leaders, you know, in our communities that are being proactive. And one of the things I do want to mention though, so some businesses don't have a lot of outside dining, or they want to put out outside dining. It's very important to know that if you have a liquor license, an ABC license, those outside areas may not be okay to be serving alcohol. You're going to have to look at your ABC license and what your plan was, your site plan for outside dining, if you have it, and whether you can serve alcohol out there. So that's a really big point to make.
You know, Kathy, we also had, oops, sorry if that was me. Lisa Medina is actually on with us as well. And Lisa, do you want to introduce yourself and give us any feedback on that piece?
Okay, I mean, either way, we prefer usually to take it down.
Yes, good morning, everybody. I'm sorry, but I had to step out for just a moment. So could you please repeat the question?
Yeah, I just wanted you to introduce yourself and where you're from. And then also, Kathy was giving some direction on outdoor dining and wanted to see if you had any points to weigh in on.
Sure. Well, hello. Good morning, everybody. Thank you for inviting me to your meeting. It's really great to get everybody's perspective, you know, from a regulator's perspective to actual business owners and operators. So we thank you for that. So my name is Lisa Medina. I am currently the manager for the Environmental Health Department and the CUPA programs, which is a Certified Unified Program Agency. I have been with our department for over 4.5 years and love my job, and I love making sure that our constituents are happy, and I'm very proactive and collaborative in working with our business operators. Related to the outside dining, for the outside seating, the distancing standards as discussed by previous persons will be set in place. We have had some issues and some complaints that have been called into the center regarding this. You know, it's really difficult to discern sometimes whether people are going to be just waiting for takeout and or delivery, and whether or not they'll be sitting down. But since the dine-in is now allowed for outdoor seating, that maintenance of the physical distancing will be required, and that would be 6 feet. One of the things that we would be concerned about, of course, is the people tend to, when they're outdoor seating, you know, they tend to kind of congregate. So that's one of the things that we would be concerned about. We are going to be relying on, you know, the operators and the managers of the facilities to put that in force. As our inspectors begin to conduct the inspections, I want to assure everybody that we are not going to be out there to make sure that you have those protocols in place, which means that we will not be reviewing your protocol, because the onus will be on the owner operators and managers of the restaurant facility. So please be reassured that we will not be enforcing that. You know, our staff will take a look and say, hey, you know, these people are complying, you know, with all the requirements and the directives. But our approach is more of an educational and collaborative approach versus enforcement at this time.
Thank you for elaborating on that. I think that's important for us to know there. Kathy, I'm going to have Marita ask a question that I think would be good for us to hear. So the lube room, she said, uses the Buzz Bling system, and it worked well last weekend when there were many people. People were asked to wait outside. So that's helpful. And I'm guessing Marita is talking about the handheld buzzers, right?
Right.
So,
and they light up, so when it's your turn to be seated, it lights up like a spaceship, and it vibrates, and then you know it's your turn to be seated.
Yeah, so that's an option too. Okay, awesome. Thank you so much to Lisa for kind of explaining from her perspective and seeing how she is involved with us as a collaborator.
Absolutely.
All right, Kathy, continue on. Show us more.
So one of the questions that came up was, how many people can be seated at a table, and do I need to be 6 feet away from my family at my own table? The answer is no. If you're with your family at a family unit, you can sit at the table together, and don't need to be 6 feet apart. Another good point that came up is, and this is at a couple restaurants I've been in, there's just one server. So there's not a server that's going to multiple tables. In other words, so there's just one person serving a table. And again, another good point, face coverings are not face masks. And there are some really cute ones out there. In fact, I just had some made for Census 2020, which is a whole nother story, another topic that we need to cover someday.
Hey, Kathy, I have another question.
Okay.
So June Andona asked, she said, we're a business where the customers order at the counter and seat themselves. A hostess is not practical for us. Is this a mandatory guidance?
So if they're at the counter, they grab their food, they sit down and eat. So I'm not understanding. Can you repeat the question?
Yeah, you know what? Let me have her hop on here.
Because I can't see it.
That's okay. She said, we're a business where the customers order at the counter and seat themselves. A hostess is not practical for us. Is this mandatory guidance?
So the guidance for serving is not mandatory. I mean, you can order your food, pick it up, sit down and eat, but the cleaning and disinfecting will be. I mean, it's going to be practiced that after they leave, somebody's going to have to clean, or, I mean, I guess you could ask the patron to clean, but I don't know how that would work out.
So this is
am I understanding the question correctly? I can't see it.
This is Kristen. I think I could provide an answer just in general, and then go dive into this a little bit more. So the purpose of the guidance is meant to be generalized enough to be able to be mindful of a larger restaurant and a smaller restaurant, right?
Right.
So with that, it's not like, the direct answer to your question, Ms. Andona, is no, you do not need to add a hostess to become in compliance with this guidance. the guidance is mandatory in the concept of it, right? Like you have to follow the guidance to the best possible. But that being said, that does not mean you have to add additional staff to that maybe aren't specifically listed in this guidance. It's more about doing your very, very best to create that physical distancing, to create those sanitation measures and those types of things. A business does not need to completely modify itself and add staff that never existed or positions that never existed. It's more about just trying to get to the core concepts of mitigating risk as much as possible and creating distance and safety and sanitary measures as much as possible.
June, you're actually unmuted. Did that clear up your question? Did you hear me, June? Okay, well.
Sorry, yes, I'm here.
Oh, okay, awesome, awesome. Did that answer your question?
It did. There's a lot of businesses that their model is not set up for hostessing, and so that was one of our concerns. Since I have you guys, can I ask another question?
Sure.
So you guys are mentioning you were sanitizing tables after each use, which we completely think is necessary. Our tables are picnic tables, which are not the easiest to sanitize. Our plan at the moment is we ordered a bunch of vinyl to cover our tables and our picnic tables and their chairs. Do you guys think that's a smart move, or should we be looking at it differently?
I think that's a great move.
Kristen, was that you?
Yes, that was me. I think that's a great practice and a great modification, especially if I believe you said they're vinyl. Being able to sanitize those will be much easier. I think that's a great idea and a strong recommendation to anybody else who's using picnic tables.
And this is Colleen. I also think a lot of the businesses, a lot of the restaurants that I go to in the county are exactly what you're talking about. And so I think another option to also think about is if you're having people line up to place their order, that you put lines on the ground 6 feet apart so that people know where to stop. And then the other thing that the guidance talks about too is if you have menus, to have either disposable menus or have menus that can be wiped down, or if you can make the menus, I don't know if you have chalkboards or whatever, but as long as they're large enough that people can see them. But the idea is that, so when someone places the order, you're not right up next to each other. And it's exactly what Kristen said. The motivation behind this is to do the absolutely best that you can. And again, keeping your eye on the big picture, which is we're all just trying to keep Calaveras safe, right? And so minimizing the contact you have between the customer and then the people who are taking the order and taking the money, wiping everything down. Those are probably pretty standard things that you already do. So, you know, it might not be as hard as it sounds.
Awesome.
Thank you.
Thank you, Colleen.
Thank you. And then I'm going to add one more question in here, and then Kathy, we'll go back to you.
Okay.
Tanya, are you there? Are you on?
I am on.
Hey, good morning, Tanya Peterson. Welcome to the show.
Thank you. I'm glad June asked that question because I was going to ask it for her. The other question I had, and it relates to June's business, when it does get busier in downtown Murphy's and people are going in and out of brick and mortar bathrooms, not porta potties, is it truly realistic for people to have to clean their bathroom after each person? Because, you know, if you've spent any time in the weekends in Murphy's, it's almost an impossibility to do that when you have a line of 6 people waiting to go to the bathroom. So it's kind of a nuts and bolts question, but I would love to have some guidance on that to be able to share with others.
So can you hear me?
Yes.
This is Kathy. So that's a really, really good question. I know that there's, you know, seat covers in many restrooms. Sometimes they run out. I've heard guidance that you should be cleaning 3 times a day, that your employees maintain a log of when they're cleaning. I've not heard anything any more specific than that. Have you, Colleen or Kristen?
No, I'm checking the guidance right now. Go ahead, Colleen.
So what I was exactly gonna say to check the guidance. I think that the really important parts are to think about the touch spots of where people go. So it would be a really good idea to wipe down the handles of the sink, to wipe down the handles of the doors. Those are really important touch areas. The handle on the toilet itself to be flushed. Those are really important touch areas. That's where the virus could spread.
And I'm not seeing any direct specificity about every single thing. I have to, I'll keep looking and then chime back in on this. But, this is kind of the area too where our recommendation would be, again, being mindful of the spirit of the guidance and the, which is to do your very best to mitigate. So a practice that I'm thinking about is you could have individual, like the wipes available as you enter. A customer could take that, do a wipe down, and then maybe a little sign that says, please wipe down as before and after. So it doesn't necessarily have to be the business is standing there each single time and doing and wiping everything down. It's more about what measures can you put into place to move further along within the spirit of this guidance. If there's any businesses on the line too who have some good ideas about how you could increase sanitation specifically for a restroom, in addition to creating the distance with the tape and such, which has already been discussed, I would love to hear them. That was just an idea I had.
Good, thank you, Kathy and Colleen and Kristen and Morgan and Emily for answering that question.
Awesome, thanks, Tanya.
And can I just say one quick thing? This is Colleen. Sorry, the number one way to prevent the spread of this virus is to wash your hands a lot. So I think that's the really important thing, is encouraging your patrons, encouraging your staff, everybody wash your hands a lot and don't touch your face. But I think that's really also the really important part of this whole thing.
Yeah, I had a thought on that. Not as a business owner anymore, but I used to be. And that is that you have signs already under law that say employees must wash their hands, but maybe something that's a little more directed at the patrons themselves to check that they've washed their hands for 20 seconds, that they've done those things, so that everybody's have a little bit of responsibility, and there's that notice in each bathroom. That would be one thing that I would do.
Awesome. Kathy, you want to give us a little bit more orientation there?
Yeah, sure. So a couple other things to help minimize the impact or minimize potential transmission is, I know that a lot of restaurants, they pre-set up their tables with their glassware, their plates. That should probably be discouraged. I think that if you have flatware and glassware, stemware out, I know it looks really pretty, but it's probably not practical. So that's one of the things that they're discouraging from the guidance. And also pre-rolling your silverware. So a lot of restaurants do that, where they pre-roll with the napkin the silverware that people are using. Let me see what else we got.
As you're looking, we have another question that perhaps Kristen, Colleen, or Gina can answer. Chrissy actually said, how much responsibility does the business have to make sure you're only seating household units together? We had someone ask to make a reservation last night for 8 people, yet we know this person has not been with these people throughout the lockdown.
Good question. And again, that's up to your judgment. I mean, we're not going to be checking IDs. It doesn't say we need to check IDs or, have proof of familial relationships. That's going to be up to each individual business to determine what they are comfortable with. The guidance isn't specific, and it's not something like there's going to be, policing this. So.
Awesome. Thanks, Chrissy. I hope that answered your question, kind of.
I mean, I think that that's a real problem. Obviously, as a business owner, you can say, hey, could we break you up into 2 groups? Or I don't know. I mean, because that's one of the questions that came in that was actually on the guidance, in fact, about large parties. Limit the number of patrons at a single table to a household unit or patrons who have asked to be seated together. Okay. People in the same party seated at the same table do not have to be 6 feet apart. All members of the party must be present before seating. And host must bring the entire party to the table at one time. Well, that's kind of interesting because sometimes people are stragglers. So the guidance is that whoever, if you've got a party of 8, they all need to be there and you seat them at one time. So hopefully that helps, Chrissy. So moving on through the guidance, directional pathways, that's a good thing, but most of our businesses don't have an in and an outdoor, or and some do. Maybe they do have a side door where people could come in one way and exit another way. So you're not passing each, so patrons and are not passing each other, trying to get in and trying to get out, trying to keep that 6-foot distancing. Let me see, what are some other good points here? I took notes last night, but I've been looking at the screen and not looking at my notes. Sorry.
What I would like to do, and Kathy, while you're kind of gathering your notes there, we don't have, Tanya did just ask, I'll ask Tanya's question and then I'll move on. She said, how does the family unit or party of 8 go with the shelter in place orders of people or groups not gathering during this time period?
Okay, let me see if I can see. How does a family party?
So Morgan, if I understand your question correctly, it's discussing how does one eat when we still have a shelter in place concept, right? Or not a shelter, excuse me, a stay-at-home order. Those are almost too contradictory. So I think this whole process, right, is an extremely complicated, gray, nuanced process, right? So I respect that. I think that's a very, we do still have the stay-at-home order for the entire state. That being said, you're going to see counties who obviously are going to receive these abilities to move forward. And so you're going to have to start seeing restaurants open. And so I'm going to go out on a limb here and go where I think that how this fits is that, you know, we've defined essential services as being able to get food to feed one's family. You're going to a restaurant, you're getting food. So therefore, you are, that's an allowable activity. So our community members who are visiting our local restaurants to obtain food are in compliance with both the concept of the stay-at-home order for the state, as well as within our local counties. Of course, if you read the guidance, it has, and I'm talking about the state guidance, it has loose description about you shouldn't be traveling great distances. That's how it's defined. So I think everybody's just going to have to do their very best to live in this gray. But that would be my response from HHSA, and I feel pretty comfortable with that response.
Awesome. Awesome. And I know Kathy's going to have some more guidance here for us. I'd like to interject and see if anybody in the group, because I know we've all received hordes of questions, and I wanted to see if there is a common question that any of you as panelists get that has not been asked yet that we can ask.
Are you asking the panelists or the
panelists?
Okay.
Yeah.
Okay, so one that I get and that I've been getting is availability of supplies. So, and supply chain, both from the sanitary cleaning standpoint and also from meat and fresh produce. I know this time has been very difficult. Obviously, those businesses that had to close for dining in lost a lot of meat and produce. That stuff is not going to hang around for months. Now there's issues with supply chain. I know that there have been some, and maybe, hopefully, I'm not sure who's all on here, but I know some folks were blessed enough that they were able to freeze a lot of their supplies and then working to thaw those and make fabulous meals again. I know that supply chain is a big deal. The other good thing is that we are in California, produce is starting to come back on, and working with local farmers and ranchers, that is a huge plus. We do have some in the Central Valley that, you know, work to supply Calaveras County. And also we have the great resource that actually, Morgan, you were the one to bring up, which was Ferguson, who's now providing like gloves and sanitizer, because that's another big thing that we're hearing is like, I can't get sanitizer. I can't even get materials to make sanitizer. We do have a list of resources which we can pop up here.
So
and
Hunt
cleaning
and
supplies.
Sons locally, they have advertised that they have an EPA-friendly disinfectant, a spray disinfectant. If you would like a catalog, and I don't know if you have it up, Kathy, but Ferguson has a lot of PPE stuff, and they can do same-day delivery. Their closest branch is in Jackson. But they have anywhere from sanitizer and gloves and disposable masks, reusable masks, all kinds of fun stuff. So, and there is no charge for delivery either, which is also a nice perk. So I can put that information for both Hunt and Sons and for Ferguson in the contact, or if you would like to receive, I have a PDF of their catalog too. So if you'd like that, I'll put my email address. Go ahead and reach out to me as well.
Morgan, I have an FAQ that I've been getting a lot lately. This is Kristen.
Awesome.
It's particularly in terms of alcohol. How does alcohol, given bars are supposed to be closed, but then alcohol can be served, right, for dine-in restaurants. And I think the important parts, on the guidance, there is specifics on page 3 at the top is where it starts. And basically, in a nutshell, what it addresses is alcohol can be sold as long as there is food at the business. And then there's some specifics about how that food can be obtained, whether it be contracted out and the vendors on site or actually within the business itself. And that alcohol must be sold at the same transaction as the meal. So again, that's another area that's a little bit nuanced, but that there is specific detail about alcohol and how that is can be sold within the dine-in restaurant arena. So I would like to draw everybody's attention to that. That's where we're going off.
Thanks, Kristen.
Thank you.
Morgan.
Yeah.
Comment too on some of the FAQ. As I talk with people, regardless of the industry, I always encourage them to reach out to their particular licensing agency or regulatory agency. As I find that, for instance, in this case with environmental health and the ABC, both agencies have been very helpful in giving good information, the most accurate information as we know at the time. I also encourage people to reach out to their insurance company. They perhaps have been closed or they modified their businesses. So as you reopen to this level, make sure that you're still in compliance, and perhaps your insurance has some additional guidelines they'd like you to follow. So if something does happen, you're more or less covered. So those are things I always encourage people to kind of, not necessarily always on the checklist, but just make sure that you're continue to be in compliance, want to do the right thing, and check out with these agencies. I also encourage people that there's a lot of misinformation out there, whether we get from our neighbor or we're looking at social media or we peruse the internet and hear all sorts of things. And this is just another avenue to kind of keep your information focused and a go-to site that you can find reliable information. The website here that has been shared by Colleen and Kristen in regards to California Department of Public Health is really good, as well as the ABC and environmental health for this particular industry. And I always say, don't forget Osha. That was also mentioned earlier. And another good resource in regards to the employee safety component, lots of good information. And I'm finding that as we continue to move forward, they're providing graphs and charts and info material that you don't have to sit and recreate. You can print it off and use it for your particular business, maybe a slight modification, but really good resources for those kinds of things.
Thank you, Debbie. Great resources there. A couple of questions, and maybe Kristen, you just gave an explanation of it in the chat, but if you want to share, because June asked, can you clarify the section referencing alcohol on page 3 on the guidance does not list dine-in restaurants?
Yeah, that's a great question. So the entire guidance is meant to address dine-in restaurants. And then within the guidance, you're going to see more specificity for different types of dine-in experiences, right? So the brew pubs, the wineries and such. And so that's where you can kind of noodle down into that. But the guidance as a whole is meant to address dine-in restaurants.
Perfect. And then we have another question here from Tanya. How does one go about checking on as a community member, let's say a winery tasting room that may be planning on selling glasses of wine and or cheese to their patrons at the same time one purchase, and may or may not be a restaurant or have their correct ABC licensing, and or if they're serving people on their patio? How do people go about knowing if a business is complying, right, licensing and following phase 2 protocol versus is the business just doing whatever they want regardless of licensing or procedures?
So I can take that. This is Kristen.
Okay.
In terms of, because we started first, I'll try to unpack that a little bit with the concept of wineries. So wineries, page 3 is where we're given that specific guidance where wineries can be in operation with all the modifications we've gone over and that are easily available so long as they're serving sit-down dine-in meals, right? So that kind of addresses that, and then they're following those requirements. In terms of compliance, I had said this at the Board of Supervisors meeting. As we moved into phase 2, public health is not going to be requiring each local business to turn in their plan to us to demonstrate compliance. We know that our community is fantastic, and we know that everybody is doing all they very much can to become to move into this for the protection of their community members as much as possible. And that's evidenced by the number of people we have on the technical assistance webinar today. So we, again, are not going to be checking each individual plan. That being said, as we have been this entire time throughout the COVID pandemic response, people do have the ability to call into the community call center, that number's been plastered all over the community, if they believe that a business is not in compliance with the phase 2 guidance. And how we'll follow up is just educating that business about what the guidance is and how they can access the information. That's going to be how we move into that space if we need to. But again, we're coming from an educational assistance standpoint. I also would say that in the press releases that we released out, as well as in this guidance, it states that each business should have a copy of their checklist and their plan available on site. So if a customer wishes to review that information, they have the ability to ask that of the individual establishment. And then they also always have their personal choice to dine at that restaurant or not.
Great.
That's
Awesome.
great, Kristen. Thank you.
All right, Kathy.
So I know we're getting up on an hour here, hour and 3 minutes. So I just want to touch on a few more things and then show the sample written worksite specific plan that I just came up with. And my stomach's growling, so I hope nobody can hear it. Okay, so where am I? Where did I go? Oh, here I am. So I need to close this. Trying to go back. Wait, stop. I can't see the screen share now.
If you're watching this recording while Kathy's pulling this
there we
up,
go.
the call center number, in case you need to call, is 209-754-2896, and that is in the webinar chat. Thanks, Colleen.
Okay, so we were talking about, I was almost to the end of the guidance because there's a couple things I wanted to point out. And the guidance is pretty thorough, but again, it's open to what works for your business. Our businesses are very, very different. Some are larger, some are smaller. So here's a big one, because this is a personal pet peeve of mine. I have an issue with touching other people's pens. And I know the other day I went to check out and they handed me a clipboard with a pen to sign on my slip, my card slip. And I was like, yeah, no. And I have my own pen. So again, that's one of those high touch areas that some people think about, some people don't. Same as shelving and menus. Having disposable menus, that's kind of not economically or environmentally friendly. But if you have a menu posted or a chalkboard, this is a great way for people to see what they can order, or online menus. I mean, a lot of places do have online menus where you can just look at your phone and determine what you want to order, and then they have their specials that are up on the chalkboard. And this kind of goes to, how do I know who's legitimate, who's not, who's actually following the proper guidance, who has the permitting and the licensing. All restaurants do have their license. It's to be posted. There's also a set of rules that you could have, visible rules. So as people are walking in or walking to the restroom or walking to their table, there's rules that, so people know what it is that you're doing to protect them and to protect your employees. Have hand sanitizers available. And this is one of the things that Ferguson has. I love those hands-free sanitizers. You just wave your hand underneath it and the sanitizer comes out, so you're not touching it. This one may be a tough one, but I mean, you may have a guest or visitor who's hacking away. And how do you ask them to politely wear a face covering, or potentially ask them to leave if they're, because I know that I was in a restaurant not too long ago waiting in line, and there was a sick little kid in front of me. It made me really uncomfortable. So again, people have to use their best thoughts and their best ideas on how to do this. So with that being said, I'm going to pop over to the draft sample worksite plan. So this is something I just created yesterday. A lot of people are asking, okay, so it says I have to have a written worksite specific plan. That isn't just checking off the check boxes on the checklist. That is part of the guidance. It's the checklist, but it says in there that you need to have a written worksite specific plan. So it's specific to your business. So I just created this. It's in a Word doc, but it's, you know, you have to put in the name of the business, the person responsible, the address, and then the risk assessment. This has been all over the map. I've seen some that are really technical. I've seen some that really didn't do the job, but this is really up to each business to figure out, what are your risks? Where are your high to low risks? And I'm not a restaurant owner. I've not had the honor to be a restaurant owner, but I'm a fabulous patron especially for our county. But I just kind of thought of where I thought places would be, and whether they would be high and low. And again, this is just a sample. This is not anything that's, you know, in writing. This is just an idea. But
Abby, are you going to share this with everybody? Or are you going to create a link to this? Richard Verasso just asked.
I can. But nobody's seen this. I just like whipped this up yesterday. So I don't know that I have, you know, all the blessings of those that be. And I certainly don't want to do anything without blessings. So
Yeah.
other areas, high touch areas, are obviously door handles. We don't have, a lot of restaurants don't have automatic door handles or doors that open automatically. You know, surfaces, plating, bussing tables, these are all areas of potential transmission. So then training and communications with employees, again, I think there's 6 or 7 bullets at the very beginning of the guidance that talks about what needs to be in your plan. So your training and communications with employees, whether you're doing daily staff briefings, meetings, weekly trainings, following state guidance, following Osha guidance, and the checklist below, process to check for compliance, and to document and correct deficiencies. If you see something, you need to correct it. Maybe twice daily inspections, maybe 3 times, whatever is going to work for your business based on how busy you are and your availability. You record that information, document, document, document. And where do you see things kind of falling through the cracks? How do you correct for that? Maybe it means more training. Maybe it means an additional debrief or briefing the next day for your employees. And then again, identify and isolate close workplace contacts. Try and keep your employees distanced as well. We're talking about customers and such, but we also need to think about our employees need to be distanced. And I know in working with coworkers, sometimes our social distancing isn't what it should be. We feel familial, we feel friendly, we work together, but we also need to think about our employees and keeping them distant as well. So this is just a sample. Ms. Doe will ask sick employees to stay home and conduct monitoring wellness checks of staff and employees. If staff are not well, I will ask that they go home and contact their healthcare provider. And if I have additional questions or I have an employee test positive, I will contact Calaveras County Public Health. And then you need to update this document. Things change. As I said, this has been a very fluid situation. We've all been kind of building the plane and flying the plane, and you need to update it if things change, if restrictions get more restrictive or less restrictive, or you see something that you develop that's not working.
So to people that are watching, what we'll do is we'll put a sample plan like what Kathy has here in the Back to Business Toolkit, which we've been sharing out, but will be, it's hosted on the Chamber's site. So if you haven't seen that yet, it's a live document that we constantly update. So I'll have that updated tonight with the written worksite specific plan. Awesome. Well, before we wrap up here, I know there's a few other questions, and thank you, Kathy, for that guidance. And what I think is so important that we talk about with this is that we're not trying to reinvent the wheel. We're not trying to recreate something. We're trying to break down what's already put together. And what's actually pretty amazing is that the state created some pretty fantastic resources for us on a very, very short notice. And so what we'd rather do is kind of help you dissect that a little bit. And in conversations that we've had together in the past, we realized the need for not recreating something, but instead helping to give tips and tools on what this the state has provided for us. Now, I know that that Emily had a really good question come up, and she actually posted this in the chat. And I think Kathy also mentioned that she was getting this. So Emily, I'm going to have you talk a little bit about employees, meaning a lot of restaurants have laid off employees. And so now is the time when we're saying, okay, well, we're ready for you to come back, but they've had, hopefully if they've received funding from EDD, then they might be receiving a nice amount, and it might be hard to get them to entice them to come back. So can you talk a little bit about that?
Yeah, that is actually a question that we've gotten, that EDD has gotten, and EDD employees have shared with us. There was a conference call yesterday with directors, and that was one of the main questions that was asked throughout the state. We're going to be getting a little more clarity on that, but I do want to point out that each week that somebody's receiving unemployment benefits, they need to certify, starting from May 9th, that they have looked for work. And they have to certify whether they accepted or declined any work. So if somebody's not accepting work that's being offered, then that could be not what it is that they're supposed to, that they're certifying. So that's something to consider. EDD has told us to tell employers that if somebody's saying that they're refusing to work, that you should report that to EDD. Then the question was, okay, how do we do that? and that's the answer we're waiting for. So we're still getting there. I do have that there are 2 places on there. There's benefits overpayment information, and there's a fraud reporting on the EDD website. So those are just 2 places that you could go if you wanted to do that. That's just one of the things. So there's other things that I know I don't want to take up too much time here, but if you do have questions about bringing back employees and how you can maybe get help with affording that because you've had 2 months of lost income, please give me a call, because we might be able to find a way that some of our programs that are designed to help people get back to work or to get retrained can dovetail in with some of your needs. So thanks.
I think that there's more value in that, and probably affects a lot of the attendees that are watching, because I mean, restaurants especially, we had to lay off so many. And so that's a very realistic question that I'm sure people are asking. What's interesting is that we want to be delicate with the issue, but I think that having a message going out, and maybe Emily, you can tell me, does EDD have any messaging going out to kind of inform people? Because, you know, it's going to have to, they're going to have to break the information that all of a sudden people are going to have to transition back because dine-in places are now being allowed and restaurants are opening up. Well,
So I believe that that's in the requirement for them to certify for their benefits. That's complicated by the fact that there are a lot of delays and people aren't getting their certification notices. Those are behind, so that could be an issue. The other thing is that you do want to walk that fine line, that if somebody has children and they cannot find childcare for them, then they have a legitimate claim for the pandemic unemployment assistance or for remaining on unemployment benefits. So it is a little bit trickier if somebody's meets certain qualifications, because there are those 2 tandem programs. There's unemployment benefits and there's pandemic unemployment assistance. Plus there's also, you know, the need to really honor that if people aren't able to come in because they're in a medically they're one of the high-risk groups, for example. So you may find that you're in a place where you have to replace employees that were good employees that would want to come back to work or that can't come back to work now. So if that's the case, then again, I'm a resource, and hopefully you can, and any questions that you guys ask, we're on this weekly call. So I am collecting those frequently asked questions, sending them into the state, and we're going to get some things going on. Again, I know we're kind of all in that boat where things are changing. Information is a little bit behind sometimes. EDD has a lot of, I could give you a lot of statistics about how many people we've had apply for unemployment and pandemic unemployment assistance, if anybody cared to know. It's a lot.
Yeah. Well, thank you. Thank you for sharing that. Emily's a great resource. So her contact information is in the chat. Please feel free to reach out to her. I'm saying that she likes phone calls at 10 o'clock at night and 3 in the morning. So we do have another question, and any of you panelists that have some feedback, please let us know. Tanya asked, how do we as a county get the word out to non-stay-in-place visitors who have been and will be coming to our destination Highway 4 corridor from the Bay Area, Valley, or even from the east side when the pass opens very soon, maybe even today, that we are slowly getting out our business sea legs underneath us and are trying to be mindful to the phase 2 guidance plans? Can the county do a public service announcement to inform our visitors that they need to help us observe and respect the guidelines? Many Murphy's and Arnold business owners are very concerned about the crowd that will show up over Memorial Day weekend. Thanks. Yeah, I think that's across the
Hi. It's Colleen. I have an answer to that, even though it's not a public health thing. So I hear on the National Public Radio all the time, the Calaveras Visitors Bureau say very nicely, like, please don't come to Calaveras until we open. And if you go to the Calaveras Visitors Bureau website, there's an entire, like, pops up right away that says Calaveras Visitors Bureau is asking visitors to asking to respect our community and not visit at this time. our healthcare facilities lack, and it goes through the whole thing. So I think, and that's the message that we've been kind of sending out to through our public health channels as well. And I think that they've done a great job of getting that message out there.
Yeah. Thank you so much, Colleen, for that. I think that's a good response there. I want to say a special thank you to everyone on the panelists. And before we close out, if this has been beneficial to you, and we have some incredible people in attendance right now, and we wanted to make at least this first webinar really a resource so that we can put this out for all the people that weren't able to join us live, and with the goal that it can be watched in the future. So thank you to those of you that participated in asking questions. And if you feel like it would be a really great resource to have a roundtable with other restaurant owners in Calaveras County, meaning that you guys can collaborate, talk freely back and forth in a forum similar to this, except open-ended, where you're not just in view-only mode, then please reach out to me, mgace@calaveras.org. I'll take the funnel for it, because we would love to maybe host one if that would be a benefit to you, to continue the discussion next week. So it would be a different style. It wouldn't just be us reporting and answering questions. It would be actually an open collaborative. So if that would be something helpful for you, then please, again, mgace@calaveras.org. And my email is in the chat there too. So yeah, thank you so much. And each person on this call has been a leader in their own industry, working tirelessly. I know Debbie Ponte has been like literally going business to business and talking with business owners, and Colleen and Kristen, oh my goodness, you guys, I can't even imagine your job. I'm so glad you guys can do that. It's way beyond my knowledge base. And Lisa, thank you for sharing on behalf of your role, that we're in this together and you're there as educational support. And Emily, with just, you know, all of the training that you provide for both employers and employees. And obviously to our fearless leader, Kathy, representing the county. So grateful for each of you guys and the wisdom that you're bringing, and what you've provided for restaurant owners today. So we're going to continue this dialogue, and we're doing a retail one this afternoon. So if you know anybody that has not heard, please share out. 2:00 p.m. today, we're doing something similar for retail. If you continue to have questions, we'll reach out to you guys, put your information in. And again, email me if you want information on the roundtable for restaurant owners in the future, and also if you want the PPE guide from Ferguson.
Hey, Morgan, hold on.
Yeah.
Isn't our retail at 1 o'clock today?
It's at 2 o'clock. 2 o'clock.
Oh, I've been telling people 1 o'clock.
Uh-oh.
My bad. It's at 2 o'clock.
2 o'clock today. So retail is at 2 o'clock. Thank you guys so
Morgan,
much.
Thank you.
Morgan, thank you and the Chamber for hosting this and taking the lead. Certainly appreciate it. Thank you.
It was a
Thank
pleasure.
you.
Such a
Thank
pleasure.
you.
Thank you, everyone. Take care.
Bye-bye.
Bye-bye.
Bye-bye.